Which of the following is the priority intervention for a patient with suspected acute coronary syndrome? Correct answer is option C. Obtain a 12-lead ECG. What is the most common side effect of opioid analgesic? Correct answer is option D. Constipation. A patient is receiving heparin therapy. Which lab value should the nurse monitor? Correct answer is option B. Activated partial thromboplastin time. Which of the following is an early sign of hypoxia? Correct answer is option C. Tachycardia. Which of the following is a potential complication of prolonged immobility? Correct answer is option C. Deep vein thrombosis. A nurse is caring for a patient with type 1 diabetes. Which of the following is the most common cause of hypoglycemia in this patient? Correct answer is option B. Too much insulin. Which of the following is the priority intervention when caring for a patient with an active seizure? Correct answer is option A. Protect the patient from injury. A patient is undergoing hemodialysis. What is the primary concern during dialysis? Correct answer is option D. Bleeding. Which of the following is a characteristic symptom of hyperthyroidism? Correct answer is option C. Heat intolerance. What is the priority action when a patient with a tracheostomy tube has the tube become dislodged? Correct answer is option D. Cover the stoma and provide oxygen via a face mask. What is the primary goal when managing a patient with chronic obstructive pulmonary disease? Correct answer is option A. Improve oxygenation. Which of the following is a potential complication of a myocardial infarction? Correct answer is option B. Dysrhythmia. A nurse is caring for a patient who is receiving total parenteral nutrition. What is the most important action the nurse should take? Correct answer is option B. Monitor blood glucose levels frequently. A patient is receiving a blood transfusion. The nurse notices that the patient is having a reaction. What should be the nurse's immediate action? Correct answer is option B. Stop the transfusion and notify the physician. Which of the following is the most appropriate nursing intervention for a patient who is post-operative and has an elevated temperature? Correct answer is option D. Assess for signs of infection. A 68-year-old patient with a history of hypertension and diabetes is admitted with diabetic ketoacidosis. What is the most critical lab result to monitor? Correct answer is option C. What is the first step in performing cardiopulmonary resuscitation (CPR) on an adult patient? Correct answer is option B. Call for help. Which of the following is a complication of fluid overload in a patient receiving intravenous fluids? Correct answer is option B. Edema. What is the primary responsibility of a nurse superintendent? Correct answer is option B. Surviving nursing staff. The nurse is caring for a patient with a closed head injury. Which of the following findings would indicate increased intracranial pressure? Correct answer is option C. Dilated pupils, unresponsive to light. A 28-year-old pregnant woman is at 32 weeks gestation and present with complaints of swelling in her feet and hands. What is the priority nursing assessment? Which of the following is the priority intervention when caring for a patient with an active seizure? Correct answer is option A. Protect the patient from injury. Which of the following is the most common cause of abnormal uterine bleeding in premenopausal women? Correct answer is option A. Uterine fibroids. Which hormone is primarily responsible for the development of the ovarian follicle? Correct answer is option C. Follicle stimulating hormone. Which of the following is a primary cause of spontaneous abortion? Correct answer is option B. Chromosomal abnormalities. In a patient with suspected endometriosis, which diagnostic test is most definitive? Correct answer is option C. Laparoscopic. Which of the following is the most common type of breast cancer? Correct answer is option D. Invasive ductal carcinoma. Which of the following actions should the nurse take when caring for a patient with a chest tube after surgery? Correct answer is option B. Which of the following is the most appropriate action for a nurse when administering an intramuscular injection? Correct answer is option D. Which of the following indicates an effective teaching strategy when educating a patient on wound care? Correct answer is option B.